right, so how do the needles feel for you right now then, Meg?
They're a little, like, getting heavy.
They're getting heavy, but did you say, do you feel like they've calmed down a lot since the start? Good. Hi, Megan.
Hey.
Good to see you. Megan actually is an old coworker from how many years ago? Like 10 years?
Yeah.
She's like a long time. We were lifeguards together, and then she kind of refound me on Instagram after having a little bit of an injury a few months back that's now starting to affect her hobbies. So I'm going to let her tell us about her patient case. So Meg, why don't you go ahead?
Yeah, so in December, I fell down some stairs and hit my back a few times, and I got it checked out at the time. There was no like damage, but it was really swollen.
And who checked it out?
Like the ER.
You went to the ER.
Yeah,
Okay.
like after a week I went to the ER. It was very painful. So I had a pinched nerve. Once the swelling went down after 6 weeks, it unpinched and all the pain went away and I was good, except I lost feeling in my hip here and it never really came back. It's still numb at times. And then like my back has been fine since then, but I spent a lot of time at my desk in June and now it's bugging me again. And it was before today, it was very stiff, like at the tailbone, and worse, like right when I wake up in the morning. Okay. And I work out in the morning, so I don't know if that's correlated, but like by the time I'm done my workout, my back pain's gone away. Okay. Kind of thing. So then this morning, I went to the gym, did some deadlifts, my back went like pop, 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 and the pain has kind of moved to the left side, right, like here. And it's probably worse. Like I took Advil this afternoon because it got worse.
So you took the Advil after you had the pop, pop, pop sensation. Was that kind of like down the center? Was it on one side?
It's down the center,
it was down the center. And now you're saying it's feeling worse on the left side.
On the left side, yeah.
Now this physical complaint is also one that you typically deal with through exercise, right? And you find that after your workouts, you feel better afterwards.
Yeah.
Okay. So that's a really good indication that we're dealing with mechanical pain, as you guys would know by now. Movement is conducive to healing, so the fact that Megan is moving and her pain is decreasing with those movements, very good indicator. However, deadlifts, as somebody who deadlifts, it's a difficult exercise, and you can think you're doing it correctly and realize you're not doing it correctly. And Meg, like, I mean, I know that you powerlift quite regularly, so you're probably, I imagine that you're solid on form. Have you ever had it checked out and like confirmed, like, yes, this is proper?
Yeah. Okay. I was making some tweaks this morning with my form to try to get into, like, I know my form's pretty good, but it can definitely be better. So I was playing around with different foot positioning, and that's when it happened.
Fair. Okay. Yeah. So it sounds like what happened in this incident was probably an unanticipated self-adjustment, which can be quite painful if you're not prepared for it, especially if you are doing an exercise that is as loaded as a deadlift. So that sounds like it's kind of re-aggravated the injury, and as she reports, we're kind of getting over to the left side now. But there's definitely things we can do about that for today. Now, do you have anything else? You mentioned you kind of had that hip numbness. Where in the hip are you feeling that?
Like right here.
Okay, so on the outside aspect.
Yeah.
So I don't know if you can see it on camera, but she's pointing to her greater trochanter area. I'll throw a picture up there so that you guys can see as well, and I'll show you in the app as well so you know exactly what I'm talking about. And any other complaints for today? Is it really just limited to that low back?
It's really just limited to that. I think like I've got general tightness in my hamstrings, but I work on that regularly, and like the rest of my mobility is fine.
How do you try to address the hamstring tightness?
Like just stretching.
Stretching it. Yeah. Okay. What kind of hamstring stretches do you do?
Like I roll it out and then I just do like the one where it's up like this or like down like that.
Got it. Now, does that help the low back discomfort, or do you find that it aggravates? It doesn't really have any relation.
I think that one's okay. I also get a lot of pain in my hip flexors and stretching. I find when those hurt a lot, my back gets worse. But when they are better, like my back is better. Yeah.
Right. And that also makes sense because anytime you get an issue with one location in the body, a joint, you'll get discomfort above and below the chain. So anytime you get hip discomfort, very likely get knee complaints or back pain. Are you getting any knee pain ever or not?
No, I can dislocate this patella.
Okay,
pretty frequently, but
let's not do that today. Okay, let's save that for off camera.
Yeah, it's fine.
Okay, all right.
Yeah,
but is there one hip that's worse than the other?
No,
left, right?
I think they're okay.
Just kind of okay. All right.
Yeah. Recently, my deadlifts looked like this with the right side going
with
faster.
Right side hiking.
Yeah,
okay.
but like I don't. That doesn't bother me. It just looks funny.
It's a little strange.
Yeah.
Okay. All right. So I think that kind of covers everything we need in the history there. Do you have any questions before we get into the physical then?
No.
No? Awesome. Now, Meg's complaint is on her left side. We're going to start with the right side because we can consider that to be her normal. So I'm going to go ahead and I'm just going to take this leg, nice Burks, and just relax it, okay? I want you to drop the leg. You let me move you.
Okay.
And just lift it straight on up. You let me know if you're getting any discomfort in the low back with this.
No.
No? All right. Actually, Meg is able to get up to 90 degrees, so we're going to consider that a 100% pass on the right side.
Nice.
Now let's check the symptomatic side, see if we get any discomforts or not. So I'm going to go ahead, again, relax the leg, and lift that straight up, and any discomfort in the back with this?
Like a little bit. Probably like a 1. Like I feel it, it's not.
But it's there.
Yeah.
Okay, now where in the lower back?
Like on the left side.
On the left side,
Yeah.
like, are we talking like in the glute region or higher up?
Higher up.
Higher up in the glute region, okay. So we'll bring that back down. Now we're going to do our SI thigh thrust. I'm going to go ahead and bend at the knee here. Bring this over. I'm going to place my hand behind her SI joint and push through. Any pain with that?
No.
No? Awesome. Okay. Now we're going to do the same thing on this side over here. I'm going to bring this over. And any pain with that? Ooh,
Yeah.
So that hurt a lot,
Yeah.
Because you jumped at me.
Sorry.
All right. So no, that's totally okay. That's actually a good thing that you did. Okay. So is that typically the pain that you feel?
Yeah.
Okay. So Meg tested super positive on that left SI joint. Okay. So even with just that, pretty likely we're dealing with an SI restriction, or at least a history of SI problems. We're still going to do a few more tests to make sure that we're on the right track there, but I think this might be a pretty open and shut case.
My coach mentioned the SI this morning, by the way.
Is today the first day you've heard of the SI joint?
Yeah.
I'm going to show you, and I'll put it up there on the screen because you guys have seen it many times by now, but I'm going to show you on my app over there exactly what I'm talking about when I say SI. Okay?
Can you fix it?
Yes.
Okay.
Yes, we can fix it as Kairos. Kairos is like our specialty. Okay, good. Right leg here, and you just relax for me. Okay. What we're going to do is we're going to test the internal rotation of this side, and we can get to about 45 degrees, which is pretty impressive. I'm going to go ahead and bring this back the other way now, and we're going to, nope, you just keep it right there, okay? Now I'm going to bend out like that. Any discomfort with either of those movements?
No.
No? Okay, let's do that the other way around.
I think there's going to be more on this side.
So you think there's going to be more what?
Discomfort. Discomfort?
Okay. So let's do the internal rotation. How's that? That's okay?
Yeah.
That's okay?
It hurts a little bit, like right here.
We're getting some pinching there.
Yeah.
Again. Okay, so we got 45 degrees there.
It's not a lot, though.
And we're going to do the external rotation. We're going to mind the microphone. That's okay?
Yeah.
What do you feel?
Like, it's tight, but it's okay.
Where?
Like here.
It's still in that region there, huh? Okay.
I don't like that.
You don't like that?
Oh, it's still back on the back.
It's in the back still?
Yeah.
Okay. Definitely have hip involvement with this low back complaint. So, as I was saying before, our body's kind of like a chain. When we have an issue with one location, as Meg has said, she has a problem with her hips, we're going to be getting discomfort and pain perceived above and below the chain, or dysfunction above and below the chain, rather. So we're going to be examining kind of her lower thoracic spine as well. And the lumbar region, we definitely, at least I'm pretty convinced that we have an issue with that left SI already, but let's just go ahead and feel through. What kind of chiro would we be if we didn't use our hands? So you just relax for me as good as you can, okay?
Okay.
Right side. So sacrum, ilium, SI joint.
Okay.
Okay? That's okay?
Yeah.
How's that?
It's different, but it's okay. It doesn't hurt.
Okay. Not as bad as that thigh thrust that we did?
No.
Okay, good. So.
Does that make sense?
Yes. So, y'all can't see this on camera, but I'm bending her knee. I'm picking it up, placing my hand over that SI, and pulling here. Is that okay?
Yeah.
Good. That's okay as well?
Yeah.
Good. So, hand's going to be placed on the front of your hip there.
Okay.
Good. And
yeah, I get some pinching there.
some pinching there.
Yeah.
Okay.
Yeah.
That's worse as we go higher, right?
Yeah. That's fine.
That's okay. All right. So when I take my hand off the SI and go into some of the lower lumbars, it looks like we actually get worse aggravation. So possible that our problem is more in this region, which we can absolutely work to free up. Any tenderness here?
Yeah.
Okay. And let's compare that to the other side. Any there?
No, it
Good.
feels really different.
Very, like, significant difference.
Yeah.
Okay, good. Well, not good, but good. Tender at all up into this region?
No, but it tickles.
Coochie coo.
Look, ow.
Alright, good stuff. And we're just going to check the glute musculature. So off of the iliums, alright, we have our glute medius, which is in this region here, and we have our piriformis, which goes from the sacrum out to our greater trochanter here. Are you okay if I have a palpate through to check for hypertonicity? Good. Hypertonicity is the fancy word for things being tighter than they should be, in case you were curious. So you let me know if you're getting any kind of tenderness through here.
No.
Good. And piriformis. This actually doesn't feel too bad. I'm surprised.
Really?
Yes.
So maybe it's not SI?
No. It's definitely got SI involvement, but I'm just kind of surprised that your muscles haven't been firing on to try to compensate for that. But it's all good. It's a good thing for you, if anything. So, Meg has never been to a chiropractor before, so this is going to be her first adjustment ever, and it's going to be on that symptomatic SI that we were talking about beforehand. So let's see what we got. So the way that this is going to work is that I'm going to get you, you're already laying on your side. I'm going to actually turn this a little bit more, and you're going to grip right there. Good.
Is that hurt?
It will not hurt, but
Okay.
for the first time you're getting this done, it might be a little bit shocking, okay?
Okay.
Because nobody's really, well, there's nothing that can quite relate to it. So
Okay.
let's just give this a try. I'm going to bring this leg up, and I'm going to get you to scoot your hips a little bit closer to me, please. Good. All right. Now from here, I'm going to get you to take a deep breath in for me, and all the way out, all the way out. Good. Ooh. There we go. So we had a little one there, and then we had a second one as well.
Yeah.
Okay. How you feel?
Good.
That was fine, right?
Good, yeah.
Good. Okay, good. We're gonna do the other side now. So good. Now from this position, we're gonna actually get you to scooch your hips closer to the edge. Thank you. Yep. And I'm gonna take this arm. I'm actually gonna try to rotate your upper body so that your back is on the table. There you go. Perfect. Okay. You're gonna stay just like that. And I forgot to say that this is Meg, right lower back. Breath in. And all the way out, all the way out, all the way out. Good. There we go. There's a big one. How you doing?
Good.
Good.
Yeah.
So we got a big release there. Don't know if we heard it amongst the table moving, but that was a big one. Yeah.
Yeah.
Trochanter area, as she was mentioning before, she's experiencing some numbness there. So you can find that by actually just going up the side of your leg right up until you reach a very bony prominence right there, and that's the spot that you're getting the numbness in. Huh?
Yeah.
Yeah. All right. You're
I
laughing.
like this.
You nervous?
Yeah.
All right. Now you say the word. We don't need to do it.
I
Okay.
wanna do it.
You want to do it?
Yeah.
Okay. All right. Consent is important, guys, especially in this day and age. So, just above the greater trochanter, right in that region there. You have nothing to be oh my godding about right now. You okay?
Yeah.
You okay?
Yeah.
What do you feel?
I don't know, a needle.
Yeah. Okay. Good. So, guess what? She felt that. All right. That's one. You're doing good, Meg.
I hate it.
If you want it out, I'll take it out. You
Really?
say the word.
How long does that have to stay in for?
So we're probably going to be keeping these in for 10 minutes to start, okay?
Okay.
Fantastic news. On the sessions coming up, it'll be a little longer.
You can't do this. Oh my god.
You're okay. Breathe for 10 seconds. Okay, breathe. Big breath. Awesome. Good job. So Meg, while I'm doing this, why don't I distract you by asking a question?
Okay.
Are you okay?
Yeah.
Now, you're obviously a very big lifter, and I know that you lift just the same reasons that everybody else ever works out, and that's to escape some kind of underlying emotional damage. But aside from that, what do you find most rewarding about lifting heavy-ass weight?
Definitely the feeling of accomplishment.
Okay, so, like, what is it about? Like, elaborate on that.
You
a
know,
little
you
bit
set a
for us.
goal,
Mhm.
and then you work towards it, and then you reach the goal, and it feels good.
Well, I'm happy that you get that from a source, right? We all need some way to feel good about ourselves, like we are working towards something. And working out definitely was a big one for me as well, especially in my undergrad days when I didn't have much else to do. So, And one more, okay? Last one. Surviving? Good.
I don't feel that at all.
Good. You're not actually supposed to feel the needles.
Really?
Like, you can feel them, but like they're usually small enough that they're just like minor things versus like if you got 4 injections, you'd probably feel those.
I feel like I feel them right now.
Well, just take a breath, okay? Here, what we're going to do is we're going to hook them up to a little bit of current.
What?
We're going to hook them up to a little bit of current, as we discussed before. And then you can take a quick 10-minute power nap.
I'm not having a good time anymore.
Do you want them out?
No.
No? Okay. Talk about mixed messages. Alright, so. 1.
Is this gonna hurt?
No. I guess that can be a little bit of a frightening thing to hear, hooking up current, but this is very, very normal, and I can explain to you how it works. So there's 2 mechanisms of action through acupuncture. One is pain gate theory, and the other is opioid-like theory. So pain gate theory, the idea is that the brain can actually only register one input at a time from any one location. So one of these input, yes, obviously, is going to be pain, and the other can just be kind of like any kind of sensation whatsoever. So when you stub your toe, what's the first thing you do? You grab it, you squeeze it, yeah?
Yeah.
So that is actually you unconsciously using pain gate theory to try to override your brain's perception of pain. Now, opioid-like theory is why people will exercise for the purposes of rehab or pain reduction. So our body synthesizes many different hormones that are similar to opioids, and acupuncture is actually able to stimulate that through an exercise-like mechanism. So what you're going to notice is I'm turning the current on now, and as we turn it up high enough, we should eventually get a very, very gentle pulsing sensation through the affected regions. And when that's, you feel it there?
Yeah.
Perfect. Okay, so that is us using the opioid theory.
I wasn't listening to you talk about the opioid theory.
That's okay.
Okay, my leg is twitching now.
Yep, that's normal. You okay?
Yeah.
That's normal. So that's what we're trying to do. We're introducing a small current which activates the muscles, and that's what stimulates the opioid-like production.
I don't like it.
You don't like it?
It's like, okay, it's fine.
Okay.
Like, I don't like it at all. Is it supposed to be this much?
Now, is that a little bit too intense? We'll turn it right down for you.
Okay, turn it down.
Okay. Is that a little better?
No. That's better.
There you go. And we're still getting the pulsations. We can see that here, so that's perfect. Okay, now Meg, what we're going to do is we're going to chill out for about 10 minutes in this position, okay?
Okay.
All right, now if you need off at any time, you say the word, and we'll take you off.
Yeah, I don't do that, but that's okay.
Good. All right, so how do the needles feel for you right now then, Meg?
They're a little, like, getting heavy.
They're getting heavy, but did you say, do you feel like they've calmed down a lot since the start? Good, good, good. All right, so the current is off. I'm gonna take off the wiring now.
Yeah, I'm getting nervous again.
You have no reason to be nervous.
Know,
this is the easy part.
I know. Okay.
She was so calm while they were in, and now she's all stressing. Meg, how did you find all of that?
Great, it was good.
Good?
Yeah.
Good? Okay,
Yeah.
so what, I know the acupuncture was a little bit frightening for you, but how do you feel now that we're kind of past that? So Meg's got a mild?
Mild fainting.
Mild previous history of fainting with needles, but she put on her tough face and managed to get through without fainting today. That's why it's very important to always lay your patient down, FYI, okay, because we don't want that to happen. But how do you feel now that
good,
that's
my hip feels good.
Good,
yeah.
I'm happy to hear that. And otherwise, how'd you find the adjusting and the kind of massage component?
Good, I think my back feels looser.
Good.
So.
Have you ever had that done to you before, anything like that before?
No.
Okay.
It was good. You
Good.
explained everything. We're good to go.
Awesome. Happy to hear it. So as I've said before, before. It's important to see somebody for your musculoskeletal care. Meg's currently seeing a massage therapist, you said, and then a massage therapist is one option, chiro is another, physio is another. Ideally, you'd want to see them all, but happy you came in today.
Thanks.
Pretty sure we're going to be able to get this SI complaint under control, and I guess we'll just end on a high five, okay?
Awesome.
There we go. Thank you so much.
Better than the last one.